Contact tracing. Will you give up privacy for safety? The purpose of this essay is to inform the public of the privacy issues surrounding contact tracing during the COVID-19 pandemic. This paper shall explain what contact tracing is, current global issues with contact tracing, and the impact this has on your privacy. My objective is to promote the public to form their own opinion based on evidence when considering losing their privacy rights in the name of public safety through public surveillance. I encourage everyone to read the source articles and make their own conclusions by keeping updated from formal news corporations, alternative media, and reading medical journals daily. What is contact tracing? The UK government describes contact tracing as the use of a mobile phone to monitor the location of an individual to accurately predict the human interactions that spread a virus. The BBC outlined that data is collected by Bluetooth interactions, or if people do not own a mobile phone, may have to wear a Bluetooth wristband. Global contact tracing issues. Around the world, governments and private companies are contributing towards a solution that will enable the economy to return to normal. The World Health Organization, WHO, Bill Gates, and the Oxford University Hospital, who are leading the vaccination trials, have stated that contact tracing will be essential to this solution. Early in the pandemic, researchers reported on the success South Korea had in using contact tracing to contain the spread of the virus. As a result, creating effective contact tracing systems has been the objective of governments. However, the constant surveillance on citizens has created privacy debates. One such debate Reuters highlighted is ongoing between Germany and France against Google and Apple, regarding if a centralized or decentralized system should be used to store contact tracing data. Having a centralized data pool means data is sent to a government to monitor, while alternatively, a decentralized data pool means that phone apps send data to private companies. In the simplest terms, the factor decides if a government or private business see your data. However, the New York Times reports as over 2.4 million people in Australia are currently using contact tracing, Amazon is overseeing the centralized data storage. This means both government and a private company have access to an individual's location. The BBC reports that NHS will use a centralized model, only for collecting health data to improve the app as the disease spreads. The NHS rejected the model proposed by Google and Apple. In China, where the virus originated, a centralized model is used, which has been highly praised by the WHO. However, the USA have questioned China's reported figures. This resulted in President Trump stopping WHO funding, of which USA was the lead contributor of $400 million. Contact tracing privacy implications. These issues surrounding contact tracing are a matter of how the public will be under surveillance and what will happen to their data. In other countries, such as China, contact tracing is mandatory and requires users to input more personal information than Australia's system, according to the BBC. This information is used in China's social scoring system, which determines a citizen's reputation score. This score is visible to other citizens, and if an individual's score falls low enough, punishments such as not being able to use air or train travel can be issued. With these issues, it is rational that a contact tracing app that keeps citizens under surveillance has potential for a lack of privacy and data misuse. The BBC reported that a state of surveillance is a price worth paying. This displays that some formal news corporations support state surveillance. Such support was highlighted as a warning in a letter signed by 300 leading information security academics from all over the globe. This letter states that to respect privacy rights of citizens, any contact tracing app should adhere to 4 main principles. 1. Contact tracing apps must only collect the bare minimum data to prevent COVID-19 spreading. 2. Any contact tracing data captured must be via a transparent method. 3. In contact tracing apps, all options that provide the most privacy must be enabled. 4. Use of contact tracing apps must be voluntary. Data control must remain with the user and ultimately be deleted when the current crisis is over. A week after this letter was published, hundreds of UK information security academics wrote an echoing letter directed to the NHS in order to prevent mission creep. Mission creep meaning the gradual expansion of an activity beyond the original purpose. Conclusion: academic leaders in information security have united to warn the public. If the public do not listen and do not remain informed of ongoing developments, privacy rights will be lost. Lost in the name of public safety through public surveillance. Privacy is now under debate. Everyone must answer 3 questions. Each answer will reflect the individual's value of their own freedom. Will you allow a government or business to always know your location? Will you allow them to know it forever after this pandemic? Will you give up privacy for safety?